Good morning. My name is Jagdeep Aluwalia, and I am the founding secretary of the Indo-American Chamber of Commerce of Greater Houston, which I currently serve as executive director. Join me in thanking Dr. Parijatam Thomas for accepting our invitation to share her knowledge and experience. I do want to point out that this presentation is for educational purpose only. For any medical advice, please contact your physician. I want to introduce our Chamber Executive Committee, our board, our directors at large, and our advisors. Today's webinar will be recorded, and we are live on Facebook through the IACCGH Facebook account and several other Facebook accounts of our partners, both locally and in India. We are proud to be serving the business community for over 20 years, and we work closely with our sister chambers and associations. On behalf of IACCGH, we thank our partner organizations who help promote today's event, our community partner organizations, and our media partners. We thank our partners for today's event, the Indian Doctors Association, and the following supporting organizations: the Indian American Cancer Network, IACC India, our sister chambers across India, the India Culture Center, Seva International, the Texas West African Chamber of Commerce, the World Trade Center Mumbai, the Asian Chamber, the Greater Houston Black Chamber, the Ismaili Chamber. We want to thank our long-term sponsors whose support helps us to continue to serve the community. These include Brask Inc., Lyondell Basell, Piping Technology, Shipcom, Foster Global, St. Luke's, and Amir Ali Dodia. We thank and recognize Shell for sponsoring our Women Mean Business and Distinguished Lecture Series. I would now like to invite our guest speaker, Dr. Priya Thomas. Dr. Priya Thomas is an associate professor of clinical cancer prevention with a joint appointment in breast medical oncology at MD Anderson. She also serves as associate medical director for the Lyda Hill Cancer Prevention Center. Dr. Thomas has research interests in breast cancer prevention and conducts prevention clinical trials in women at high risk for breast cancer. I will now hand over to Dr. Thomas, who will make her presentation. If anybody has questions, please type them into the chat box, and your questions, if appropriate, will be answered at the end of the event. With that, it's my honor and privilege to welcome Dr. Thomas to make her presentation.
Thank you for the introduction. Thank you, everyone, for inviting me to speak. We can go to the next slide. So this topic is on the 9 ways you can reduce your cancer risk. As well as Jagdeep had already mentioned, I am a breast medical oncologist, so I work on treating breast cancer, but I also have interest in breast cancer prevention and work in our cancer prevention center at MD Anderson. So this presentation will be about how to reduce your cancer risk for all cancers. Next slide. So often, sometimes people will think, it doesn't matter what I do, or if I'm going to get cancer, I'll get it no matter what. But what it is that these statements are actually not true. And about up to 50% of cancers are preventable by our healthy lifestyle choices. Next slide. So this is going to give us some tips to how we can lower our cancer risk. It's not that cancer is not inevitable. We can have actions that we can take, and there are tests that your doctor can order to detect cancer at its earliest and treatable stages. So the objectives I hope that you all can learn from this presentation is to, 1, increase your awareness of cancer risk reduction behaviors, screening exams, and screening recommendations, motivate you to identify and adopt cancer risk reduction behaviors to lower your cancer risk, as well as encouraging you to talk to your doctor about screening recommendations and getting the appropriate screening exams for you. Next slide. So first is to maintain a healthy weight. So we know that obesity and being overweight is associated with cancer risk in multiple cancers, and most recently, they have associated with 13 different cancers. So maintaining a healthy weight is important for many chronic medical diseases, as well as reducing your cancer risk. Right? So how can we maintain our healthy weight? So it's eating less, moving more. So you want to have taking an appropriate amount of calories, eat your diet and nutrition, as well as keeping active. Next slide. So as far as nutrition goes, we recommend eating a plant-based diet. So what does that mean? It means that trying to fill your 2/3 of your plate with plants at every meal. So that includes vegetables, whole grains, and fruit. The other third can be lean animal protein, which we try to focus like as far as in fish or chicken, or plant-based protein like tofu, beans, nuts. Research has shown that eating more fruits and vegetables greatly lowers your risk of developing several cancers. Whole grains are another plant-based food that's loaded with fiber, and also examples of that is brown and wild rice, quinoa, and whole grain corn. Next slide. Things to limit is red meat. So we recommend, it might be a little bit hard to read on this slide, but 12 to 18 ounces of cooked red meat per week. So that includes, as far as what we call as red meat, is beef, pork, lamb, venison, and goat. Because we have seen associations, especially with colon cancer, with increased red meat intake. So typical serving size is 3 ounces. So here we have a visual to kind of have an idea of how much that we're talking about, as 12 to 18 ounces can be a bit abstract. So here are kind of 8 golf ball size servings in the week, or 6 deck of cards, to 4 tennis balls or 2 softballs. And you can see how that equates to the number of ounces per serving. So what do you think? I know that you're not able to do on the webinar style the thumbs up, but think about, do you feel that eating processed meats, kind of like bacon or the deli meats, does that increase your cancer risk? And that answer is yes, it does. So that processed meats do increase cancer risk, and we try to avoid that. Next slide. So we do recommend limiting processed meats. So that includes hot dogs, bacon, sausage, pepperoni, deli meat. So kind of more, as you can see in the picture, instead of hot dogs, trying to do like grilled meat, grilled chicken. Instead of the deli meat sandwich, trying to go for a salad with meat. Slide. The number 3 thing that we would recommend is staying active and keeping moving. There has been association with being sedentary and increasing cancer risk. And especially now in the pandemic and working remotely, more and more people start to become more sedentary. We're sitting more often and at the computer. So it's very important to keep moving. That's even just walking around. So we often recommend taking a 1 to 2 minute stroll or walking every hour that you're sitting. So we're not just sitting for long periods of time. Next slide. So we also recommend exercising. So the recommendation is to move 150 minutes of moderate intensity exercise per week. So this is above your usual walking, kind of walking and moving around. So this is what I tell people is that's something that gets your heart rate up, maybe break a sweat. So examples of moderate intensity exercise would be walking, again, a more fast-paced walk than your usual, yoga, mowing the lawn, something that has a little bit more activity than your standard moving around the house. You can even break this up into 10 minutes at a time. So 150 minutes, that's 2.5 hours per week. It can sound daunting if you haven't been doing anything at all. I always say 10, 15 minutes twice a week and start to build yourself up from there. Next slide. Alternatively, the recommendation is you can, if you want to do 150 minutes of moderate intensity exercise, or you can do 75 minutes of vigorous exercise. So this is a little bit more higher intensity. And 75 minutes per week is a healthy goal. So these examples would be running or jogging, a fast bicycling, swimming, something that will get your heart rate up even higher. Next slide. Also important is building strength and building your muscles. So we recommend muscle strengthening exercises at least twice per week. Strength training helps you maintain that healthy weight because the larger and stronger your muscles are, the higher your metabolism is, and you're going to burn more calories that way when you're at rest and even if you're not active. And so even people may think, oh, I have to exercise hours per week. An hour of strength training, so 30 minutes twice a week, will keep you maintain your muscle mass. And so that is just very important. So it doesn't have to be a long duration of exercise. Next slide. Fourth, and I think what most people know is to not smoke or use tobacco products. Smoking is the #1 leading cause for preventable cancer deaths. So of course we can't reiterate as much how important it is to not smoke or use tobacco products. And it's directly responsible for more than 80% of lung cancer. Next slide. So, but I don't smoke. Could I still be at risk? And the answer is yes, because if you're around smoke, you're still inhaling those carcinogens. So secondhand smoke is whatever comes from those cigars, pipes, cigarettes, and the smoke is exhaled and you can breathe that in. And this still puts you at risk for cancer, heart disease, and other respiratory complications. So the best way to protect yourself from secondhand smoke is requesting that smoking not be done indoors. And that's why there's often now more and more mandates about indoor smoking is prohibited. There is information about third-hand smoke, which is the residue from these smoke particles that can be on upholstery or carpet or furniture where someone has smoked. That impact is not well understood, but could be potentially hazardous. Next slide. So now we have e-cigarettes and vaping products, and the question is, oh, maybe those are better for you than cigarettes, and that may be a good way to quit smoking. The fact of the matter is, it is not a good way to quit smoking. Next slide. So they have not been proven to be safer than cigarettes, and it is not an effective way to quit smoking. But you may see that these products can be advertised, oh, that might be safer than a cigarette. The e-cigarettes deliver nicotine into the body when a user inhales the aerosol or liquid nicotine, an aerosol of liquid nicotine, and it can come in many flavors, which then again it becomes even more tempting to use. The aerosol is not harmless water vapor, and they have not been proven to show that they help smokers quit. What has been shown to help quit smoking is a combination of counseling, nicotine replacement in the form of patches, gum, or lozenges, and medication is the best way to quit smoking or using tobacco. Again, and e-cigarettes can damage your respiratory system. They may look like pens or USB memory sticks, so they are still harmful. Other dangerous nicotine products still include menthol cigarettes, flavored cigar, hookah, and smokeless tobacco. Next slide. And now with these products, there has been this big campaign to reduce smoking in teenagers, which was effective. But now with e-cigarettes, this has now become more popular amongst kids and teenagers, and they should not use these e-cigarettes. There has been data to link that using nicotine before age 25 can damage parts of the brain that control attention, learning, mood, and impulse control. And they have seen that in young adults. So most of these e-cigarettes actually contain a lot of nicotine, more than you would even in a cigarette. One brand called Juul has pods that have as much nicotine as a pack of cigarettes. And because they come in different flavors, they are a high appeal to children. So again, this is to cancel with family members. Definitely, we want to avoid this in our children and teenagers. Next slide. Is limiting alcohol. So we know that alcohol intake is associated with multiple cancers. Some cancers have a higher correlation for increased risk with alcohol intake. In general, we do recommend limiting your alcohol intake. So with women, we recommend 1 alcoholic beverage per day to limit to, and with men, 2 drinks per day. The alcohol beverage size depends on the type of alcohol you consume. So as on this picture, it shows 1 serving. And so a serving of wine, 5 ounces, a 12-ounce beer, or 1.5 ounces of liquor is all equivalent to 1 alcoholic beverage. Also to note, as far as we talked about earlier about maintaining a healthy weight, note that there are extra calories in alcohol, which we kind of call it those empty calories. It's not giving you any nutrition benefits, and this can also lead to weight gain and increased body fat. So another reason to limit the alcohol intake. Next slide. So get vaccinated. So there are vaccines that can treat certain viruses that we know are associated with cancer and they can cause cancer. The big one is the human papillomavirus, HPV. It is a commonly sexually transmitted infection that can lead to a number of different cancers, including cervical cancer in women and throat cancer in men. Nearly everyone will get HPV at some point in their lives, and most of these infections go away on their own. But there are certain strains of HPV, is the ones that are known to cause cancer, and that's where the vaccines are targeting those high-risk strains. Next slide. So we do have an HPV vaccine. The question, do you think it's for girls or for both boys and girls? And the answer is that it is recommended for both boys and girls. Right. So we do recommend it for both males and females. The HPV vaccine series protects against cancer. It is safe and effective, and the HPV vaccine can prevent over 90% of cancers that are caused by this HPV virus. It includes preventing anal cancer, vaginal, cervical, and vulvar cancers. So MD Anderson recommends all males and females from ages 9 to 26 years old to receive the HPV vaccine. It is most effective when given at ages 11 to 12 and gives the body time to develop that best immune response. Females and males ages 27 to 45 are also strongly recommended to consider getting the vaccine after discussing it with their physician. Usually it's a series of 2 vaccines that are completed by age 15. After age 15, it's usually 3 doses are required. Fine. It is also to get the hepatitis B vaccine. So hepatitis B can cause liver cancer. And if you were born in the United States, you were likely vaccinated as a baby or a child against hepatitis B. If you were born outside of the United States, or you have a child, or if you are a child of someone who was born in countries or regions where hepatitis B infection is common, you should get considered tested for hepatitis B, and it can be treated if you have it. Hepatitis, with that inflammation, it has been shown to increase risk for liver cancer. Also, it can be caught from the blood, from someone else's blood. So again, it's being very careful with syringes, needles, razors, toothbrushes to avoid sharing those things. Next slide. Number 7, the next thing is to get your screening for cancers to be done. So we have very specific screening recommendations for men and women based on their age. And we have noticed, especially with the pandemic, that we have diagnosed fewer cancers since the pandemic. And that's not because the cancer is not occurring, but people were not getting their screening, especially during the beginning of this pandemic. As a breast oncologist, I can attest that we have been diagnosing higher stage breast cancers as people were returning to their screening, especially delaying that screening for 1 to 2 years. So it is very important to get your screening done. Next slide. So what tests would we be recommending? So I'm going to break it down by age group and by gender. So in women, starting at ages 21 to 29, we recommend cervical cancer screening with a Pap test every 3 years, and they can consider a clinical breast exam every 1 to 3 years, starting at age 25. Starting at ages in their 30s, we recommend continuing to screen for cervical and breast cancer, HPV test with or without a Pap test every 5 years, and a breast exam. So one thing I want to point out, people say, I got a Pap smear, and I'll say, well, did you get the HPV test with it? So it's actually 2 separate things that your doctor will do. Pap test is looking where they have a breast, and they're looking for abnormal cells in the tissue. The HPV test is testing for the virus to see if you have detect any of those high risk strains in your tissue. If the HPV test comes back negative, then we recommend your test being done every 5 years. So it's important to have both of those things done. Next slide. In the 40s, again, continuing your cervical cancer screening. And then this is when we also include breast cancer screening with a clinical breast exam and mammogram every year. Now, these recommendations are all for average risk patients. If there is something that puts you at elevated risk for a cancer, then that would be something to discuss with your physician, because you may recommend increased screening. But for the average risk person, this is the recommendation. Next slide. So this is kind of a new update, starting with age 45. We also now add the colonoscopy every 10 years. It used to be starting at age 50, but most recently the guidelines have been updated. So we recommend starting at age 45, and again, to screen for colon cancer screening. There are other alternatives for screening for colon cancer if you're nervous about doing a colonoscopy, but it is the gold standard, and I definitely would recommend it. Next slide. So for men, what tests are needed? So screening would recommend started at age 45, and we talk to your doctor about prostate cancer screening. So prostate cancer screening is recommended to discuss with your provider and when it's right for them. Often it's kind of more with those with family history of prostate cancer, African Americans. So that's something to discuss with your healthcare provider. Usually you would screen with a baseline PSA test and a baseline digital rectal exam. Also colonoscopy starting at age 45 and typically recommended every 10 years. If your colonoscopy does show something, they may recommend sooner follow-up. Next slide. So how long do we continue these screenings? So after age 75, it is a discussion with your healthcare provider. But screening guidelines are a bit open-ended, and then really the end date is dependent on the individual. Usually kind of use that baseline, the benchmark of a life expectancy of greater than 10 years. So if you're healthy, and if we detect something on your screening exam, are we going to do something about it to treat that? If we feel that we are able to and we could continue to get treatment, then we will continue screening. But if other issues are coming about, maybe if we aren't going to pursue something that we detect, that may be the time to stop screening. Next slide. Also, to get tested for hepatitis C. So both hepatitis B and C can cause liver cancer. There is no vaccine for hepatitis C. It can also cause liver cancer as well as non-Hodgkin's lymphoma. So every adult should be tested at least once in their lifetime. Get tested. If you are positive, there are treatments for it. and you can have treatment success rate over 90%. Again, this can reduce your risk for liver cancer, non-Hodgkin's lymphoma. Next. Number 8 is protect yourself from the UV rays. Skin cancer is the most common diagnosed cancer in the U.S. It's often exposure to too much sun or use of tanning beds. So the best is to stay in the shade, avoid going outdoors from 10 a.m. to 4 p.m. when possible. Next slide. And also you want to make sure you protect your skin. So when you do need to go outdoors, the best way is to use a broad spectrum sunscreen of SPF 30 or higher. Also covering up with dark, tightly woven clothing. Wearing sunglasses that could give both UVA and UVB protection. Wearing a hat with a large brim to protect your ears and neck. We recommend wearing your sunscreen indoors because windows do not block the UV rays and they don't filter out that, which is what is can lead to disruption in that skin barrier. So if you're still indoors or working inside, but you have a lot of sun coming in, recommend wearing your sunscreen inside. Next slide. Last way to reduce your cancer risk is knowing your family history. So this is very important to know who in your family has had cancer in the past. I know culturally and in the past, people may not talk about if they have cancer or don't want to talk about it. But this is very important to learn about this so it can help other members in the family. This information, along with your personal health history, helps us decide if you're at increased risk. And like I mentioned before, the screening guidelines I reviewed is for the average person, but if there's something in your family history, we know it might be associated with a syndrome or depending on personal health history, we may recommend increased screening and increased tests. About 5 to 10% of cancer cases are hereditary. And if you suspect a family member's cancer could be hereditary, the family should consider genetic counseling and testing to determine each individual's risk. I think. So we can do increased screening. So just to kind of summarize and review, you can lower your risk for cancer by maintaining a healthy weight. You can use your BMI as a guide to be in the normal BMI range, the body mass index. Eating a plant-based diet, so high in fruits and vegetables, whole grains, lean meat. Another thing I would mention is avoiding the processed foods. This is kind of where I would say avoiding processed foods. Being active, moving, getting their steps in. Since we're now working and sitting more in front of our computers, this is very important. Not smoking or using tobacco products. Limiting our alcohol intake, getting our HPV and hepatitis B vaccines, getting tested for hepatitis C, and then doing your cancer screenings, which we have available for breast, cervical cancer, colon cancer, and prostate cancer for men. Protecting your skin from the sun, and also knowing your family history so you can be prepared for what additional screening you may need. So these are kind of the ways that we recommend to how to reduce your risk for cancer and also detect it as early as possible so it can be easily treated. Our goal is to end cancer. We also, a lot of people don't realize that most people think they can come to MD Anderson for treatment, but also you can come for prevention. As I alluded before, we have a cancer prevention center where we do cancer screening for average risk individuals as well as high risk individuals. And my focus has been in breast cancer screening. This is a list of all our cancer prevention presentations, which we give out to the community. So if you'd like to hear about one of these topics, you can go to the website noted there. And next slide. If you have any other further questions, you can go to our website or call the number below if you wanted to get screening, whatnot. And lastly, there's one more slide. There is a critical need for blood, and you probably have seen in the news, especially during this pandemic. We are constantly on a shortage for blood products for our cancer patients. So if you are desire, you can schedule an appointment to participate in the blood bank for MD Anderson and donate blood for our patients. That would be greatly appreciated. We require as much as 200 units of red blood cells and 600 units of platelets a day. So we're always needing blood products. With that, that is the end of the presentation. And happy to answer any questions that they came through the chat. Thank you so much for allowing me to present today.
Thank you, Dr. Thomas. So if any of the participants in today's program have any questions, please type them in the chat box. Laura De La Rosa from MD Anderson, who helped put together today's event together, will screen the questions and present them to Dr. Thomas.
I'm not seeing any questions so far, Jagdeep, but maybe we'll give it another minute. Maybe one or two will come in.
Right. And just for the benefit of the people who have logged on and the people on Facebook, because as I've explained in the beginning, the program is educational. If you have any real healthcare or medical questions, talk to your healthcare provider. The recording of this presentation, which I believe was very, very informative, will be shared. It'll be emailed out. It'll be on the Chamber website. And it is live on several Facebook accounts. So the members of the organizations that are sending it out will be able to see the recordings or the replays on their Facebook accounts. Since there seem to be no more questions, I want to first thank Laura De La Rosa for helping invite Dr. Thomas to be today's speaker. MD Anderson has been here to help make cancer history. And as the spouse of a survivor, we are grateful to be living in a city where we have the best cancer treatment and research center in the world. So thank you, Laura. Thank you, Dr. Thomas, for a wonderful presentation. We thank our partners for today's event, the Indian Doctors Association, our supporting organizations, the Indian American Cancer Network, IACC India, India Cultural Center, Seva International, the Texas West Africa Chamber of Commerce, the World Trade Center, Mumbai, the Asian Chamber, and the Texas West African Chamber, our partner organizations who help promote our events, our community partners, and our media partners. Our upcoming event is on 7th June. It's an in-person event. We will be featuring IACCGH advisor, outgoing president of Rice University, Dr. David Lebron, who will talk on higher education yesterday, today, and tomorrow. You can register at iaccgh.com. You do need to be registered to attend. The event is free for chamber members and invited guests, and non-members can buy a ticket for $50. With that, we come to the end of today's presentation. Once again, I want to thank Laura De La Rosa with MD Anderson for helping put together today's event. And we really appreciate Dr. Parijatham Thomas for making the time, not only today, but in the preparation for today's event, to share your knowledge with the community at large, not only in Houston, but in India, to help prevent cancer. With that, today's event comes to a close. Thank you, Bhavna Kalyan with the Chamber Office, Bhavna Kalyan Baga with the Chamber Office for helping coordinate everything and put together the webinar today. With that, we come to the end of the presentation, and we hope to see you at a future presentation by MD Anderson. on a topic of your choice. Thank you very much.